Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs for Public Health. Thank you for joining us for today's ASPPH Presents webinar, Public Health Law Research Part 1, Creating and Using Open Source Policy Data for Public Health Evaluation Research. Part 2 of this series will be offered on Wednesday, April 12th. Today's webinar will be 1 hour in length. We will begin with an introduction by our moderator, followed by 3 presentations, and ending with a question and answer period. This webinar is part of the 2017 ASPPH Presents monthly series, which has been designed as a service to CEPH accredited ASPPH member schools and programs for public health. The webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. We are pleased to have with us today our moderator, Dr. Jennifer Ibrahim, a tenured associate professor in the Department of Health Services Administration and Policy and the Associate Dean for Academic Affairs for the College of Public Health at Temple University. She also serves as the Associate Director of the Public Health Law Research Program. Jennifer has been recognized by her peers as an outstanding teacher and maintains a research agenda in the areas of health policy, including work on legal infrastructure and work on tobacco control policymaking. Thank you for being here today, Jennifer.
Thank you, Sarah, and welcome to everyone who's participating with us today. And it's my pleasure to introduce 3 experts in the field and fabulous speakers. I'm going to introduce all 3 of them now, and then we'll move through each of the presentations, and as Sarah mentioned, we will conclude the hour with open questions. So first up, Lindsay Cloud. She is the director of the legal team here at the Center for Public Health Law Research at Temple University. Ms. Cloud is responsible for overseeing all aspects of legal mapping production, including both the internal and external projects. She's overseen the creation of various policy surveillance projects, including civil commitment, syringe exchange programs, distracted driving, and medical marijuana laws. Prior to coming to Temple University, Lindsay served as a fellow for the Honorable Jacqueline Fraser Lyde of the 1st Judicial District of Pennsylvania. She received her BA from the Pennsylvania State University and her JD from Widener University School of Law. Ms. Cloud is admitted to practice law in both Pennsylvania and New Jersey. Scott Burris is our second presenter. Scott is a full professor of law in public health at Temple University, where he directs the Center for Public Health Law Research. His work focuses on how law influences public health and what interventions can help make laws and law enforcement practices healthier in their effects. He's the author of over 200 books, book chapters, articles, and reports on issues including urban health, HIV/AIDS, research ethics, and the health effects of criminal law. His work has been supported by various organizations including the Open Society Institute, the National Institutes of Health, the Bill and Melinda Gates Foundation, the UK Department for International Development, the CDC, and others. He's also served as a consultant to numerous US and international organizations including the WHO, the UNODC, and UNDP. He's a founder of Legal Science, a private company dedicated to the social mission of improving access to legal information and the support of practice of policy surveillance. He's been a visiting scholar at multiple institutions globally, and in 2014 he was the recipient of the American Public Health Law Association Health Law Section Lifetime Achievement Award. And anyone who knows Scott knows that the accolades and his contribution to the field goes on and on. Bryce Pardo is an independent policy analyst in the area of drug and crime policy. His specializations include cannabis policy, opioid control, and regulations relating to new psychoactive substances. He's worked with national, state, and local governments in cannabis regulation and drug policy. He served 5 years as an official at the Inter-American Drug Abuse Control Commission within the Organization of American States. He has also worked with other multilateral institutions, including the Pan American Health Organization and independent institutions associated with the United Nations Office on Drug and Crime. His research and academic work has been published in a range of journals, including the International Journal of Drug Policy, Addiction, and various reports for the London School of Economics, the UN Office of Drug Control, the Pan American Health Organization, and the National Academy of Sciences. So with that, I'm pleased to be able to open this webinar up, and Lindsay Cloud will start our presentation.
Well, actually, it's me starting with the initial one. So if you give me control over the slides, I will move us forward. This being Scott Burris.
Oops, I apologize, Scott.
All right, I just need to get the slides to work.
You should be able to click in and then click forward.
All righty. There we go. So here I am. That's my name, and I'm delighted to be here with all of you who've tuned in. I'm going to set things up a little bit for the following two presenters. And of course, the thing I always start with is how important law is to health. Something I think you probably wouldn't be on this webinar if you didn't believe, but something which can't be said enough. This is a slide that the CDC produced at the turn of the last century, which I always like to start with because it shows the range and the extent of the effect of law in health. If you look at that list of what the CDC called the 10 great public health achievements, and then you think about where law came in, you'll see that in all of them, law has played a more or less important role. From the introduction and enforcement of mandatory vaccination, which was key to getting a high level of vaccination in this country, motor vehicle safety, which entailed everything from regulations about how you build roads and cars to requirements for how drivers behave and what safety features they use, right down to tobacco use, which has been, seriously reduced in this country and around the world, in significant part because of clean indoor air laws and labeling laws, and other features of the legal scene when it comes to tobacco. So we know law matters to health. Now, this is an old story. I show here on the left the cover page of Lemuel Shattuck's famous report to the Sanitary Commission in Massachusetts, which was, in essence, an appeal that the Commonwealth enact a comprehensive health law. Right through to Larry Gostin's work, and this is actually not even the latest edition of his treatise that covers all the different ways that law influences health. The thing is, in all that history, we've had a tendency to think of law as being about the stuff that lawyers do, as being about the rules and the doctrine. We thought about, in a sense, what law could do in theory. What we didn't think about is something that I've worked on a lot with Jen and others over the last 10 years, and that's to think about what law actually does. So, we say, gee, in theory, if you make seatbelt wearing compulsory, we'll have a high level of seatbelt wearing. But that's really, from our point of view in the science, is a hypothesis. We can tell people in the law to wear a seatbelt. That doesn't mean they will. The only way that we can know whether passing a law leads to high rates of seatbelt use is to study it as an evaluation problem, like we study the implementation and effects of any other kind of intervention in public health. The Robert Wood Johnson Foundation funded us to carry forward that idea and develop it in the Public Health Law Research Program. And among the many products of that program was a simple definition of what scientific public health law research, or now it's often being called legal epidemiology, is: the scientific study of the relation of law and legal practices to public health. And things like, an actual book describing the theory and methods of public health law research so that we can start to teach, learn, pass on, and raise the standards of monitoring and evaluation of legal practices and the effects of law on health. As we considered that work, all that evaluation and science and public health practice that was related to law, we came to realize that we shouldn't think of public health law as something that's just for lawyers. Lawyers are extremely important, and all the things you see on the side of the slide that's called public health law practice are vital to public health and have been for a century or more. Lawyers are crucial in health agencies and in NGOs and in corporations everywhere to provide counsel about health law and how to comply with health law and how to draft and create health laws. lawyers are important as representatives in the literal legal sense for public health agency clients, and in a broader sense as people who speak for good public health policy out in the world. And of course, lawyers are important doing traditional legal research to understand the ways that law can be used, at least in theory, to advance public health, to figure out the best way to use law, the way that's most consistent with our constitutions and other limitations or human rights, and to teach us all that and to guide us in all that. But that's only half the story of public health law, because the other half is this empirical side, this legal epidemiology or public health law research side. And that's a part that lawyers aren't the main actors in, right? So we have this idea of the study of legal etiology. How do law and legal practices influence health, or whether as making the world more dangerous or as an intervention to make it safer? Trying to understand how health systems use law, we call legal prevention and control, and the extent to which legal tools are actually effective, and what we're going to be talking about a lot today, policy surveillance. The scientific tracking of policy is important to health. So not just doing legal research the way a lawyer would do, but introducing some scientific techniques so that the research product can actually be used for evaluation. This we call the transdisciplinary model of public health law, because it doesn't just involve lawyers and health researchers and public health practitioners working together sort of side by side in cooperative parallel play, but because we actually see the need for and the actual reality of people in different disciplines adopting each other's knowledge, theories, and tools and deploying them as their own. So I just gave you the example of policy surveillance, and you'll see a lot of that today. You'll see that lawyers are learning how to do legal research like a scientist might. But it's also important to understand that out in the world of research and evaluation, we're seeing more and more people who've been trained outside of law come to understand basic socio-legal theory about how law works and why people obey it, and putting that into their monitoring and evaluation work. Indeed, that takes us to, and I want to demonstrate the transdisciplinary approach through this model of the 5 essential public health law services. This is something that a bunch of us in the public health law community have been working on to try and be more like public health people, even though we're lawyers, right? Which is to say that we're trying to define what it is we do in the same way that public health defines itself through the 10 essential health services. We've pulled out of the policy elements of the 10 essential health services 5 essential public health law services that we need to deliver and deliver well if we actually want to use law effectively in public health. So you can see, for example, it starts with the policy formation process and the fact that you can't really come up with good legal solutions to health problems unless you have access to the evidence and expertise of epidemiology and social and behavioral science, public health practice, of course also legal practice, and the experience of communities facing new public health problems. You have to somehow find a way to bring that together to come up with good policy ideas. Once you have a good policy idea, you certainly need lawyers to put it into legal form, to pick the right legal form. But once you have a good law, you now got to get it passed or enacted or implemented by somebody, a legislature or an executive, and that's an advocacy task. Lawyers don't have a monopoly on that. It's crucial that public health experts are there educating the public about what works and what doesn't and why we need policy action. It's important that we have stakeholders of all kinds, whether they're in industry or communities, participating in that process, so we get the political will and we actually get the good health idea into practice. Once you have a law in effect, it doesn't enforce itself. It doesn't implement itself. In fact, if you don't provide and think for and think about implementation and enforcement, that'll just be law in the books. It won't actually work as law on the streets. So we have to have lawyers, but also a lot of people in public health practice and other branches of government and even in the community working together to enforce those laws, to make sure that they really work. Most enforcement of certainly standard public health laws that are administered by health departments is not done by lawyers. It's done by non-lawyers, and yet they need to have an understanding of regulation and compliance and why people do what they do because of law in order to be effective in that job. And finally, where we get to today, you want all that to work. You hope your good legal idea, your good policy idea put into a good law, enacted and implemented, is actually going to change the world, solve the problem that you started with. And we don't know that unless we evaluate the result. Likewise, in order to evaluate the result, we need to know which places in the world have adopted that law, so we know what to study. And ideally, we like to have legal data that shows the variation in those in this legal model across places. And that's what policy surveillance gives us. And if we do all that right, it's not so much that we're reinventing any wheels. This is something we all kind of know about using law. But if we do it systematically and well, we get better results sooner. So we're going to talk a lot about policy surveillance as a public health practice. It really started with the Alcohol Policy Information System, APIS, that NIAAA funded many years ago. We in the Public Health Law Research Program took the methods of APIS and tried to write them down and publish them in our books and articles so that we have sort of a standard for policy surveillance. We defined it as the systematic collection and analysis of laws of public health significance. We tried to identify the different ways that it helps us, not just in creating legal data, but also supporting diffusion of innovation, allowing some visibility of what's going on in the law for stakeholders, and we hope also building and supporting workforce legal capacity. We didn't stop there. We built technology for coding and publishing policy surveillance information, what we call the Workbench and the original LawAtlas site, which is still present today, and Lindsay will talk about. In our company, Legal Science, we created software updating the Workbench to make legal research and coding and publishing easier. That's the Monocle system, which we're happy to tell you more about in the question season. We have built a number of web pages, including NIDA's new version of APIS, the Drug Abuse Policy System, Prescription Drug Abuse Policy System, and a new site which will be coming out soon called the Drug Abuse Policy System with more data sets. But it's not just us, I hasten to say. There's a wonderful site at UCLA at the World Policy Analysis Center, which has a great deal of international legal data available. CDC state system is another example that's been very heavily used in research. In all these systems, you can not only see the law, but you can actually download data that you can use in evaluation. So with that, let me turn it over to Lindsay.
Great. Thank you for that great framework, Scott. So as Scott said, I will be talking about policy surveillance. So you'll remember from just a few slides back that the definition of policy surveillance is the systematic collection and analysis of laws of health significance. But what makes policy surveillance scientific? Okay. So first, it uses a systematic approach with discrete but iterative steps. Second, it has a strong emphasis on transparency and replicability. And as some of you know, this is in stark contrast to traditional legal research and practice. Lastly, it creates reliable legal data through rigorous quality control measures. To aid with transparency and replicability, every dataset project created at our program following the policy surveillance process includes tools a researcher needs in evaluation. And those tools include a research protocol, a codebook, and of course, longitudinal legal data. So let's dive into the actual policy surveillance process now. So as you can see on your screen, policy surveillance is a non-linear process. The process contains 8 discrete but iterative steps depicted in the wheel. We're going to explore them one by one right now. So scoping is the first step of the policy surveillance process, and you'll determine the project's topic and parameters. At our program, we work in teams of 3 on each data set, 1 supervisor and 2 researchers. Scoping really forces your team to critically conceptualize the project by answering some critical questions. And we'll ask ourselves, what is the goal of this project? Who is the intended audience? Are the laws that we're looking at readily accessible and available to us? And finally, do we want to publish this project when we're finished with it? So it's also important to note that the scoping process is iterative as well. It refines itself as you work through the project, and in particular throughout the next step, which is conducting background research. So after scoping, you've identified a clear statement of purpose. Next, you'll conduct your background research by exploring the legal landscape of your chosen topic. Investigating the legal landscape includes reading the laws that regulate a topic, discovering the levels where these laws exist. So is this topic regulated at the state level, the federal level, the local level? Maybe the topic is regulated by all three of those levels. You'll also want to look into the key issues that these laws address. So the legal landscape is often not static, and it may be changing as you're doing your research. Once you read these laws, you'll begin to identify key variation that exists among the jurisdictions in your study. And when you near the end of your background research phase, you'll begin to develop a list of constructs. Constructs are simply the important features of the law that can vary among jurisdictions. So imagine we're creating a project on distracted driving laws. One construct could be the penalties for violating the law. So in some states, a penalty could be a fine, and that fine can vary significantly throughout the states. In other states, a penalty could be points on your license. So once the preliminary constructs have been defined, you can actually begin drafting your coding questions. So the graphic on the screen illustrates the steps to draft coding questions. However, this step can really be simplified even further. To draft your coding questions, you simply read a body of law from a sample of states. From that body of law, you finalize your list of constructs. Then you turn those constructs into your coding questions. So to revisit the example from our previous slide where our construct was penalties, your coding question could be, what is the penalty for a first violation of this distracted driving law? And after you read the text of the law in a sample of states from your background research phase, you know that potential responses could include fines, license suspension, points on your license, or even imprisonment in some states. So question development is also an iterative process, and the questions and responses will evolve as researchers begin to code the questions in more jurisdictions. So while you develop your coding questions, it's really important to remember the goals of question development. And one goal is to track and display the state of the law through a question and answer format. And this Q&A format used in policy surveillance creates data from law, which of course can be used in evaluation. So this takes large, complex areas of law and makes it easily accessible to a diverse audience. That can include policymakers, the government, researchers, the media, and of course the public. Another important goal to creating questions is to create questions that measure the law through strict observation rather than interpretation. And once you've developed your questions, you can begin to answer these questions only after you've collected and organized your law. So collecting the law consists of recording important information about relevant laws for each jurisdiction in your project. So if you're doing a project on all 51 U.S. jurisdictions, you have to collect and gather the law in all 51 U.S. jurisdictions. The important information that we want to highlight for you to collect includes the legal citation of the law, the effective date of the law, which is the date the law went into effect, the statutory history of the law, which is basically all of the citations that change in the law over time. So you're recording each change in that law over time for the period of your study. And of course, you want to collect the body of the law itself. So once you have all of this important information compiled, you can begin to organize the body of law into legal text. So for policy surveillance projects, you'll have multiple legal texts for each jurisdiction over a period of time. So again, let's turn back to our example. In our distracted driving data set, we want to look at all U.S. states. We want to start from the year the first distracted driving law was passed. So we know from our background research that Arizona passed the first law in 1996. Now we know we must collect all relevant law for each jurisdiction and organize this law into legal text from 1996 to present day. So one practical question to consider during this step is access. So does your team or organization have access to the law? Is it readily available? And if it is it coming from an encumbered source, or must you pay or request access to this source? So this comes up a lot when you're doing a local policy surveillance project where you're actually trying to collect local ordinances. This is much tougher than collecting state statutes. Now that your questions are written and your laws collected, you can get to the fun stuff, coding. Coding the law is simply using the text collected to answer the questions that you and your team developed. So to revisit our objective or observation theme introduced when we just discussed developing coding questions, the goal of coding is to read, observe, and record the law rather than read and interpret the law, which is something some lawyers have trouble with at first. This is because we want to create objective data that can be used for evaluation. And questions that are well written will demand observation, and researchers will be less likely to introduce subjectivity into their coding when these questions are written in such a way to observe the law. So at this point, we can jump into quality control, although it's important to note that quality control pervades throughout the entire policy surveillance process. A rigorous quality control process ensures reliability and transparency of the legal data. So quality control is systematically conducted in our background research phase and also our coding phase. We have our 2 researchers in our team independently research and independently code a sample of laws. We have our supervisor check this redundant research and the redundant coding. Then the supervisor records each divergence. The team then meets as a group to discuss and resolve each divergence. At the end of our policy surveillance process, when all of your jurisdictions have been coded, this initial quality control has been done, our team conducts a post-production statistical quality control check. And this is to report the overall error rate of the data set. So the supervisor will record all of these quality control measures in a research protocol document. So let's explore what the research protocol entails. The research protocol outlines the entire methodology of your project. It includes your scope, your data collection methods, your search strings, the description of your quality control measures, etc. So this allows your project to be transparent, replicable, and easily updated as laws are amended or as new laws are enacted. So the box on your screen, which lists the data, codebook, protocol, and report, can be found on each dataset's homepage at LawAtlas. So once you click the protocol button, the accompanying research protocol for that dataset will appear on your screen in PDF format for you to explore. So you've created an empirical legal dataset following our process. What's next? Now you want to think about whether you want to publish and disseminate this data set or if you want to hold it back and create a legal mapping paper or an article on it. So some questions that you might want to consider. How do you want this project to be presented? What information do you really want to highlight? What are the important findings that you really want to get out there? And of course, what is your target audience? Something to keep in mind, if your project meets our standards, one place to publish is lawatlas.org, which we host external data sets on our site, and we'll explore that in just a minute. So we can't forget about the star of today's webinar, data. One of our primary goals of policy surveillance is to create data that can be used for evaluation. Every dataset homepage has a data file that you can access by clicking the button on the screen. The free downloadable legal data, which is compatible with both CSV and Excel, can of course be overlaid with outcome data for researchers. And to accompany the data file, a researcher can also click the Codebook button on each homepage to access the project's codebook. So the codebook defines the variables and values that are included in each of our projects. So it's important to touch on the last step of the policy surveillance process, tracking and updating the law. You just created this robust resource, so you really at this time should put together a plan to track and update the data set as the laws change or as new laws are enacted. We update our data sets on a biannual basis and some on an annual basis, depending on the legal landscape. So you've just attended the crash course in policy surveillance. Congratulations. So what now? If you're interested in creating your own policy surveillance project, we have a learning library on LawAtlas. And the purpose of the library is to support researchers conducting policy surveillance and other legal mapping work. We include PowerPoints and templates and examples. Or if you're interested in using our data for evaluation, visit our site for free access to the data. We have over 60 data sets in 14 topic areas covering a wide range of public health domains. So now I think it's time to turn it over to Bryce, who's going to discuss actually using this legal data in his public health law research.
Thank you, Lindsay. That was actually quite a kind of good explanation of how I ended up kind of stumbling on PDAPs and actually how I use PDAPs to build this, let's see here. All right, so just to give you a brief explanation of what I've done, I have taken some of this legal index, the legal data to build kind of a legal index that I use to then kind of evaluate prescription drug monitoring programs in the United States over the last 15 years. This paper was published in Addiction late last year, so I'm just going to just walk you through some of the logic of how I use the system and how legal data was actually quite helpful in getting around some problems that the literature has had. So just to give you some background, not all of you may know, prescription drug abuse is a huge problem in the United States, especially in the last 15 years, with prescription opioids being kind of the main driver of overdose deaths in the United States. These are oxycodone, oxycontin, hydrocodone, these types of things. So what a lot of states have been doing is they've been passing these laws and policies to basically restrict and monitor who gets access to these controlled substances. And these programs are known as prescription drug monitoring programs or prescription monitoring programs, PMPs for short. And these are state-based systems that basically collect all sorts of information on who is prescribing what to whom. And they're intended to aid both prescribers and law enforcement in order to support legitimate use of painkillers, essentially. Really to limit doctor shopping and kind of diversion. So with that, states have been adopting these things now for the last 15 years, and the literature has been kind of mixed. So if you just throw these things into a regression model as a binary variable saying whether or not the state has a PDMP, you really get all these confounding kind of results. You really can't peel apart the strength and the difference across time and across states and over time, and really you end up with this kind of issue of simultaneity, and there's this kind of reverse causality, and so the literature has been basically very mixed until the last 2 years or so when a lot of legal data became available to us researchers so that we could actually see that there is a difference across states and over time. So the research questions in this paper that I published last year, there were several different research questions. I'm just going to look at a few here with you. The first being, are more robust prescription drug monitoring programs negatively associated with overdose deaths? And the second is there a tipping point or kind of a minimum standard with which prescription drug monitoring programs have an effect? And really, I was able to do this using legal data. Like I said before, models previous to this really just threw these things into models, or sorry, regressions usually had thrown these things in as binary variables in these models, and that causes a lot of measurement error. So what the legal data produced by PDAPs and LawAtlas did is it allows you to really measure the regulatory changes across states and over time, and I'll show you that in a bit. But it really gives you a much more precise measure of what exactly is going on across states and over time at the individual jurisdictional level. And again, this departs from this binary modeling Limitations still remain. I mean, really can't say exactly the impact across different regulatory mechanisms and how strong they are, and that's kind of the issue that we're still overcoming here. But still, nonetheless, the index really helps us to determine kind of the strength of these programs, these policies. With regard to LawAtlas and PDAPs, it's very useful. I found it to be very helpful, especially for me. I'm not a lawyer. I don't have access to Westlaw. So all of that was kind of presented to me without any need to kind of learn a new legal system or a new database. And it allows me to see very quickly the change over time. You can download the data sets and then kind of throw them into larger data frames and start modeling. So just to briefly go over the data here in this paper, the dependent variable is the age-adjusted opioid overdose death rate for 51 jurisdictions for 16 time periods for a total of 816 observations. I'm not going to get into that so much, but the main explanatory variable here that I used in this paper is this legal index, which I was able to get from data from PDAPs and from NAMSDL, which allowed me to, like I said, again, see the strength of these policy programs and interventions across states and over time, as well as control for other possible confounders. So here PDAPs provided a lot of good data on whether or not states had access to naloxone or Good Samaritan laws, as well as data on medical marijuana dispensaries, operational medical marijuana dispensaries, which a lot of the literature is now showing may actually have a negative association with opioid overdose death rates. So with a lot of this legal data, I was able to kind of create this innovative data set and build this legal index to kind of measure the strength or score, as I call it, of PDMPs, which allowed me to kind of avoid issues of multicollinearity and to actually improve the measurement improve the measurement of the explanatory variable, since this isn't a binary indicator. So the method here I basically went into the literature, looked at several different meta-analyses that looked at specific regulatory mechanisms to determine if any of these specific regulatory mechanisms had any impact on changing prescriber practices or reducing overdose deaths. And I weighted these depending on the different kind of methodological hierarchy, whether or not this was an observational study with controls, or whether or not it was just some sort of time series, or if it was just some sort of expert opinion that kind of gave an opinion on whether or not these regulatory mechanisms may have an impact on changing prescriber practices. So from that, this is a lot of data, but basically just to show you here on that first column, there are 11 different regulatory mechanisms that were identified or mentioned in the literature, either by studies themselves, kind of showing that yes, these individual components had some sort of impact on prescriber practices, or in the case of some of these, it was basically expert opinion in reports suggesting that these may have an impact on prescriber practices. And PDAPs collected all of this information. They had even more than just these 11, but these were the 11 that I could identify in the literature. And so PDAPs had whether or not these regulatory mechanisms were in place in a state in a given year, and I was able to then take all of those basically ones and zeros, and then create a weighting system and add those weights up to create basically a composite index score at the very end to show you basically, or to at least measure the strength of PDMPs across states. Again, not all these are necessarily binary. In some cases, PDAPs provided data on kind of these categorical variables. So here in that fifth variable, reporting frequency, PDAPs actually said, or it was able to reported in the law how frequent prescribers are required to send in information to PDMPs. And so I basically was able to create a kind of a baseline. It's cut off there, but basically I created a baseline reporting measure that ran from -2 to 3 with a 0 as being the kind of middle point for when PDMPs report on prescribing, when new prescriptions are filled or when they're written. So just to show you, over time we can see that yes, states do change, and over time that prescription drug monitoring programs have actually become more robust. They've actually added more of these regulatory mechanisms to their kind of policy toolkit. And so I show here that over time, starting in 1999, there were 11 states with operational PDMPs. The average score for all of those different regulatory mechanisms was about 5. And then towards the end of the time series here in 2014, 47 states had PDMPs in place with an average score of a little more than 13. And so this goes to show that if you throw these things in as binary variables, ones and zeros, you're not going to see this robust kind of difference here. And that's what you're losing. And that's why I think a lot of the literature has been very mixed in their findings and inconclusive in trying to say whether or not these policies have any impact. So just to kind of show you here that yes, they do change over time and across state. Just to give you even more kind of in-depth granularity, here's Florida, for example. That black line is the score, the index score that I created, and when it became operational, when the PDMP became operational. The red line is the death rate, opioid overdose death rate in the state, and the blue vertical line is when the PDMP law was passed. So sometimes laws were passed, and then a few years later, the PDMP came online when you actually had these systems in place and people were collecting information and dispensing it to prescribers or law enforcement. So you can see here there may actually be a bit of a negative relationship in Florida here, just for one example. Here's Louisiana, even stronger PDMP, and perhaps even stronger a negative relationship. Some states have PDMPs in place for a very long time, and the relationship here is not so clear. In the case of Maine, there could be an issue of people moving to New Hampshire because New Hampshire didn't have a PDMP until last year, so there might be an issue there with people kind of going out of state to buy prescription opioids. And then one last one, Colorado. So just to kind of show you some brief results and discussion about this. Now this is a lot of information. And you're not going to soak all this up, but this shows you the kind of robustness of using legal data to kind of really get in to what's going on. The variables there on the left-hand side, variables 2 through 12, were actually collapsed into that first variable score there. So I'm just showing you across the different states with PDMPs and without PDMPs, you can see that we can show there's a big variation in the types of different regulatory mechanisms that are adopted by states when they have an operational PDMP, a PDMP in operation. And so this really gives you a lot more information than just throwing this in as a binary variable. And again, I was able to collect legal information such as access to naloxone, whether or not a state has a Good Samaritan law in place, whether or not pain clinic laws are in operation in the state, and whether or not the state had a medical marijuana dispensary in operation. So again, legal information here really kind of gives you a lot more information than just kind of whether or not this is, whether or not the system is there or not. And the results from the regression, I'm just going to report 2 here. Using the score as a continuous variable in the regression model that I ran, using kind of state fixed effects and year time, you can read the paper for more of the methodology. But basically, the results here show that a 1-point increase in the score of the state's PDMP is associated with about a 1% reduction in opioid overdose deaths. Now, I collapsed that score variable into quartiles to see whether or not there was a tipping point, to see if I could find which combinations or which types of kind of scores may result in kind of a greater association of reduced opioid overdose deaths. And here, when I collapse them into quartiles, we see that quartile 3 and 4 have a very strong association with reductions in opioid overdose deaths, about 20% there, compared to the referent, which is no PDMP in place. So this allows you to see, well, it's not just whether or not a PDMP is in place, but really what type of mechanisms, how many mechanisms, what how strong of these mechanisms. And then we can kind of actually see a lot more than just if it's just there or not. So it's kind of the beauty of legal data. So here the discussion, use of legal data improves measurement on our explanatory variables. It really improves the analysis of policy, because before, a lot of the literature for about 5 years prior basically concluded that there's kind of a mixed effect. Some said no, some said yes. And now a lot of the literature, starting as of last year, has started to actually pull out and use specific regulatory mechanisms rather than just is there a PDMP in place. Because as we know in the literature, a lot of these PDMPs, some of them are just in name only. So they exist on paper, but they really don't do much. They don't require doctors to report, or they are very limited in how they access or how often they report prescribing behavior. So really, they can vary quite a bit. So like I said, use of legal data really gives you a better approximation of strength here of these policies. And then from that, how do we build on that? How do we improve the adoption of minimal standards? As I showed there, that those quartile scores indicates that states with much more regulatory mechanisms show a greater reduction in opioid overdose deaths. And so now some of the data that are, some of the research that is starting to come out now really is taking this in a new direction by using kind of a latent class analysis to determine combinations, specific combinations of mechanisms that are associated with opioid overdose deaths. From that, we're going to learn a lot. There's a group out of UC Davis that's actually trying to see if whether or not which combinations are really the most impactful when it comes to reducing opioid overdose deaths. And I think from that we're going to learn which policy mechanisms really are the ones that are associated with overdose deaths. And it could be that it's funding, it could be that it's reporting frequency, it could be that it's access to law enforcement. So we're going to see from these kind of more robust methods such as a latent class analysis. And with that I'll wrap up. Thank you.
Great, thank you so much. This was fabulous. Being able to see from the general framework that Scott provided, getting into the weeds and walking through the process and the logistics and the methods that Lindsay provided, and then being able to show you an actual example. So thank you to all three of our presenters today. I do want to, there we go. I know Lindsay had mentioned a couple times, this is a crash course and you're getting a first look at this. One thing I did want to share is for folks who are more interested, number one, there will be a second webinar that we'll be hosting at noon on April 12th that will be getting a little bit more in-depth into the mechanisms and the process for going through and conducting this work. And then also Kelly Comroe from Emory will actually be sharing her findings on the using a data set on minimum wage across the U.S. Across time and showing some of the research that she's been doing, merging the legal data sets with other public health data sets. So please put that down on your calendars, April 12th. The other thing, what is up on your screen right now, is we will also be hosting a Policy Surveillance Summer Institute here in Philadelphia on June 8th and 9th. So you can see on the right-hand side the flyer. Please go to LawAtlas.org for more information on that, but certainly if you're looking to get some hands-on experience, some technical assistance from the experts that we have here, please consider checking that out and consider coming to visit us in Philadelphia this summer. So we will open it up now. If folks want to add any questions, you can place them in the chat box and they will come in. Please remember your lines are muted, so you can't verbally ask questions, and also the chats, other participants in the webinar today will not be able to see the chats. So the questions will be coming in and I will be moderating the questions. So one of the questions, Scott, I'll start with you. You provided some great information, and I think we can also share some of the publications where participants can get more information. But can you talk a little bit more of where you're seeing an impact and opportunities for folks to learn more, not just about policy surveillance, but the work on public health law research more broadly?
Well, I think, one of the things that we tried to do was a sort of cultural work, which is to say that it's pretty clear if you reflect upon it, and as Bryce's study shows, that of course law is a major tool for us in public health, and it's also a factor when we think of social determinants. Law shapes who has power and who doesn't, who has resources and who doesn't. We have law that shapes lives. Whether you get arrested and what happens when you get arrested is going to shape your life, your whole life course. So law is really the same as other things we study. Other kinds of social norms, religion, information, peer pressure, however you want to conceptualize it in other disciplines, law fits right in there. And in fact, we can think of law operating by those mechanisms. So we can, for example, think of law in the context of the theory of planned behavior and realize that it's really shaping both our attitudes towards a behavior and what we think other people think of that behavior, and indeed maybe our sense of self-efficacy. So the message there is, I think, and as I say, I think Bryce really brought that out very much in his presentation. This is not about everybody becoming a lawyer. This is about realizing that we've, in social science and epidemiology, really been studying law all along, and what we're trying to do here is to simply make that a little easier. And where we see the impact is in the uptake of the data we're creating so that people don't have to become a lawyer. They can go and get the data ready-made. But also, I think, in the greater attention to where law fits into causal chains in the ways behavior and environments change and are shaped and shape health.
Great, thank you. Another question, and I'll pose this to Scott, both you and Bryce, and maybe Scott, you could give your 10,000-foot view, and then Bryce, if you could speak more specifically. So as this research is being done, legal data sets are being created and used for evaluation, where are you seeing an impact? Where is there an opportunity to use the evidence generated in these studies to actually see a change? Who could folks be working with to actually elicit that next step change to translate the evidence that you found in these studies into having an impact on the population?
Well, interestingly enough, I think we have a very strong built-in audience in Congress and state legislatures and city councils around the country. These are people who are passing laws to do something, and it actually is important to them to know whether it worked or not. And when you look at past threads of public health law and research, you see that law has an effect. Just take, for example, child safety seat belts generally. Over a 20-year period, we had this lovely iterative recurring cycle of changes in the law, front-facing seats for kids of a certain weight, etc., coming into the law, and then people studying that and reporting back to legislatures about what worked, and then seeing legislatures adopt those changes and reforms to make their laws work better. I hope we're going to see that in opioid policy from the kind of work that Bryce is doing, that legislatures are going to learn, oh, this is how we have to tune our PDMPs so that they work better. And in fact, maybe I should stop right here and pass it over to Bryce, because I think he can make this point even better than I can.
Perfect segue.
Yeah, no, I definitely agree with Scott. This is something that a lot of state legislatures are interested to see whether or not some of these policies have any impact. I know that Missouri right now is the last holdout, and there is a push to pass a PDMP law in Missouri, and they've been asking whether or not which kind of components do they need, and so they've been kind of looking at what's out there. A lot of states do adopt from other states. The question now is whether or not any of these mechanisms have any impact, and some of this research is now showing that yes, it does. Now the key is which ones are the most impactful, and I think Missouri being the last holdout will in a way benefit from that fact, that it'll be able to see all the experiments from other states and say, okay, what's most impactful are X, Y, and Z, and we can kind of start there. So I think that going forward, I think the PDMP issue will continue to kind of be something, but I think the next step is going to be really cannabis. I think a lot of states are interested in figuring out regulations on cannabis and medical cannabis, and having kind of legal data on that is going to be really valuable. The regulations on cannabis are much more diverse than what people think. It's not monolithic. So kind of looking at the legal data there, that's I think the next cutting edge is where a state regulates, how it regulates, who can access, when they can access. Those types of things will be really important for states going forward.
That's great. And I think, Bryce, you make a really good point in terms of states being able to use this from a practical perspective, looking at what's going on in other states and thinking about it in terms of the diffusion of innovation, looking to see where we've seen success and how states who are looking to intervene on the behalf of their population can use a practice that's been effective in other jurisdictions.
And Jen, I'll just say this, drug policy is clearly an important issue these days, but state legislatures pass hundreds of health laws every session on a wide range of issues. This is a target-rich environment. There is so much we're trying to do with law that's not being measured. And then when you think of social determinants and things like minimum wage systems and welfare systems and all the changes we're going to have in healthcare, these are all going to be public health law research questions that we urgently need to answer. So, I think almost whatever you're interested in, there is an important way that law will be intersecting with your existing line of work and can enrich it.
I think that's a great point. So another question And Bryce will sort of go in the reverse. I'll ask you to answer this first, and then Scott, if you can comment more broadly on this. The question of creating the index. So there is somewhat of a challenge in terms of, you presented a whole range of different legal provisions, so not thinking of the law as a full unit, but really delving down into the weeds and looking at the different provisions that operate within the context of a particular law. Can you talk a little bit about the challenges that went into building the index? How do you go through and think about this? What were other options that you may have created? And then Scott, I'll ask you to comment about the generalizability of this. Are there ways that we can be thinking about creating indices that can help us in ways that we've seen in other areas of public health more broadly?
Sure. The legal index is not entirely sure-proof. There are issues with the methodology, and it has been a challenge to try to really pull out whether or not a funding mechanism, whether or not appropriated funds is actually 3 times as strong as, say, relying on grants. So we really can't tell. I mean, these are ordinal variables, so I'm just sort of approximating strength here. Nonetheless, building the legal database, or at least legal index, is helpful for many reasons because you can actually get a lot more granularity there, and you avoid issues of multicollinearity in these regressions. Now, in the study, I basically went back and unweighted things to show that if you, just as a sensitivity analysis, if you unweight things and you remove certain aspects, it doesn't really change the outcomes that much. So I'm a little bit, I'm happy with those results so far. But the legal index has been really helpful in that regard, and trying to kind of score these things across time and over time and across states. Yeah.
So we've been working. I mean, this issue is. I mean, Bryce's study was very interesting to me because he did this, and there are definitely methodological challenges. We've been working on, in the Center for Public Health Law Research, working with some people at CDC on a methods paper on how to create an index, because it can be quite complicated. And this is, in fact, the value of the field. Once people start realizing that they can take general scientific approaches and bring them to bear in law, as Bryce has done, then the next question is, well, how do we improve how we do that? What are the special challenges of using that generic method in the case of law? And then smart people can start working on it. Go ahead, Bryce.
Yeah. No, sorry. I would like to add. No, the index needs to be kind of grounded in some sort of theory, and so it's the legal data that PDAPs gives policy researchers is invaluable. However, we still need to use kind of the theories behind and the research behind in the literature to kind of guide the development of that index. So looking at kind of the work that Brandeis has been using and the meta-analysis, looking at the individual mechanisms to show that, yes, there is an impact when a prescriber needs to check a PDMP before actually writing a prescription, and that is a legal mechanism in a lot of PDMPs, and the data that PDAPs offers us basically gives us that information, when these states adopted these mechanisms at what point in time. And so I use I basically use the theory and the literature to kind of guide the process of developing the index. So it's this kind of it's this combination of both theory and legal data that allows you to really kind of then go on and assess the policy.
That's absolutely true, and I would, in our public health law research methods, theory and practice, which Alex Wagoner and I edited and which we showed earlier, we actually devote about 1/3 of the book to theory and try and show how a wide range of theory is suitable for use in law, but it's crucial to use it, because without it, you don't have any basis to assign a weight or do anything else. So I urge that resource on you, which is also available. Entire book and all the chapters are available on our website, phlr.org, as free downloads.
And so, Scott, that was a nice segue. One of the questions that came in was asking about promotional efforts. So someone commented these are fantastic tools for public health researchers and practitioners. So as Scott just mentioned, there is the book, the website. Also, as Lindsay mentioned, LawAtlas.org. So I would direct you back to the slide set in terms of some of the resources that you can go to. Both of the websites are filled with additional resources, contact information. So a question that came in, and I'll direct this to Lindsay and to Scott, there were questions with regards to why you were focusing domestically, and in part why you were not including territories such as Puerto Rico, Guam, American Samoa, And also, are there any plans more long-term to start looking at international laws?
Today, the United States, tomorrow, the world. The future of public health law research. I mean, a lot of this has been driven by the fact that we've been trying to learn and demonstrate. And so as we learn ourselves, we can do more. Certainly, every one of those frontiers is valuable and important for us to pursue, and we are working on it.
Yeah, and to just add off of that, we have done a little bit of global work that's just not published yet because it's been written on. So I didn't touch on that on our presentation, but you may see it soon on LawAtlas.
And you know, other groups like Campaign for Tobacco-Free Kids and the World Policy Analysis Center have global resources with at least some available data. So anyone who's interested in global research comparing countries, you know, many of the principles are the same as when you're comparing states or territories in terms of the methods and how we can take advantage of natural experiments.
Great. So one last question, Lindsay, this one I'm going to give to you. When you evaluate laws using two reviewers, can you briefly describe how you resolve the discrepancies?
Sure, it's actually a bit of a complicated process, but in the simplest terms, we do a rate of divergence in Excel. So we actually calculate the rate based on the sample size, and then the supervisor reads the questions, reads the responses, and makes the ultimate decision. And at this point in time, if all three of both the researchers and the supervisor are at odds, we bring in a subject matter expert. So in my example, we would bring in an expert on distracted driving laws to make the final call.
I think one of the important things to think about when we do this kind of research is that we actually believe that it is possible to get 100% accuracy in the observation of the characteristics of the law, not the interpretation, which is very complicated, but just what does it say. And so our system, we don't sort of wait until we've coded all 50 states and then see how we diverge. We break it into small pieces. We keep learning, testing, and bringing it back so that we hope that we'll reach a point where everyone understands the coding scheme and the standards and the inclusion and exclusion criteria. That's all documented in a protocol. And at the end of 50 states, we hope to have a very high level of accuracy. We also then test that statistically, but generally we're trying to keep within 5% of perfect in all our data sets.
Great. So thank you so much. Again, thank you to all of our presenters today for spending the time. Just also, if anyone is looking for additional questions or additional contact, emails our email addresses are firstname.lastname@temple.edu. Oh, there they are. So if you have any questions, please feel free to also reach out with additional questions. So Sarah, I'll turn it back to you for final words.
Great. Thank you so much, Jennifer, Scott, Lindsay, and Bryce. That was fantastic. I know we didn't get to a few of those questions, but as Jennifer mentioned, please feel free to email the presenters directly. As a reminder, this webinar has been recorded and will be available in the archived webinar section on ASPPH.org in the next day or so. And part two, as Jennifer mentioned at the beginning of this presentation, will be presented on Wednesday, April 12th at the same time. And there are additional upcoming webinars in the ASPPH Present series. Thank you again to all our presenters and our moderator. Have a wonderful day.